Hey everyone, and welcome back. Did you know that 2025 is actually designated as the global year for the prevention of pain? It's pretty significant that the International Association for the Study of Pain, or IASP, a leading organization in this field, chose to dedicate an entire year to raising international awareness about how we can actually prevent pain. Each year, they select a specific theme to bring attention to different aspects of pain. And for 2020, the big focus was on getting pain prevention strategies out there to researchers, doctors, and, most importantly, to us, the patients. Most people experience acute pain, but ignoring persistent or severe symptoms and not seeking treatment can allow it to progress to a chronic state. In this video, I want to share 30 really practical points that I gleaned from all that information. You can actually access all of these materials and much more on the IASP's website. But here, I'm going to focus on 30 actionable ways to prevent chronic pain that are relevant to everyone: the general public, patients, and even those who are caring for someone in pain. The IASP website also has a wealth of additional resources specifically for clinicians, researchers, and even policymakers. So, let's get started and learn some really valuable things about chronic pain prevention. First, it's helpful to understand how that initial, acute pain can sometimes morph into persistent, chronic pain. It's not always a simple case of the injury just not healing. There are actually a lot of different factors at play. Biologically, things like the extent of the initial injury, the health and condition of the tissues and organs that were affected, and even underlying issues like poor posture, muscle imbalances, allergies, ongoing diseases, congenital conditions, nutritional deficiencies, and inadequate sleep can all contribute. But it's not just about the physical stuff. There are also many psychological and environmental factors that can play a significant role. These can include our mood, feelings of social isolation, experiences of abuse or trauma, and other life stressors. Any combination of these biological, psychological, and environmental factors can contribute to the initial experience of acute pain, and unfortunately, can also pave the way for that pain to become chronic. As these contributing conditions persist, the pain itself might change in character, or it might just remain constant. It's generally thought that around the 3-month mark of persistent pain, significant changes start to occur in our central nervous system. That's our brain and spinal cord. These changes involve a kind of rewiring of the neural pathways as the nervous system tries to compensate for the ongoing pain signals. There can even be structural changes in the brain itself. As this rewiring happens, even if the original site of the injury has healed or been treated, the now rewired central nervous system can continue to generate the experience of pain. This is essentially when acute pain transitions into chronic pain. Once pain becomes chronic, it's often much more challenging to treat effectively. This might be because reversing that rewiring in the central nervous system is a more complex process than addressing the initial tissue damage or injury. So, the key is really to prevent that transition from happening in the first place, or to intervene early if chronic pain starts to develop. 30 ways to prevent chronic pain. So, how can we avoid the debilitating effects of chronic pain? Well, the 30 points I'm going to summarize here can be broadly divided into 3 categories. The first 9 points relate to our general health and well-being. These are things we can do even before we experience significant pain to build resilience and potentially prevent pain from even occurring in our lives. However, since acute pain is sometimes unavoidable, the next 8 points focus on how to effectively manage acute pain in a way that helps prevent it from becoming chronic. And finally, the last 13 points are specifically for people who are starting to experience chronic pain and what they can do to prevent it from becoming truly debilitating and interfering with their enjoyment of life. For men, it's no more than 15 drinks per week, with no more than 3 on most days. A standard drink is defined as about 12 ounces of 5% alcohol, like beer, 5 ounces of 12% alcohol, like wine, or 1.5 ounces of 180 proof alcohol, like liquor, 40% alcohol, like spirits. Excessive alcohol consumption can damage nerves and contribute to various health problems that can indirectly lead to chronic pain. Eliminate smoking. It's concerning that a significant portion of my chronic pain patients are smokers. While nicotine can have some temporary pain-relieving effects, it's highly addictive, and the other substances in cigarettes are incredibly harmful to the body, increasing the risk of chronic pain and many other serious health issues. Quitting smoking is one of the most important things you can do for your long-term health and pain prevention. Work and rest in healthy posture. We spend a significant portion of our lives working, so paying attention to our posture at work, also known as ergonomics, is crucial. It's equally important to consider how we rest and recover from our work. If your job involves sitting at a computer all day, make sure to take regular breaks to stand up, stretch, and move around. If your work is physically demanding, involving lifting and carrying heavy objects, ensure you take breaks to allow your muscles to relax and your mind to rest. Proper posture and movement breaks can prevent muscle strain and imbalances that can lead to pain. Cultivate healthy sleep habits. I cannot overemphasize the importance of good sleep for preventing pain. If you're not prioritizing sleep, start now. You can find sleep questionnaires online to assess your sleep quality. If you suspect you have a sleep problem, talk to your doctor. Consider using a sleep tracking app on your smartphone to monitor your sleep patterns. You might be surprised by the quality of your sleep. In the description below, I'll include a link to a document I've prepared summarizing sleep hygiene tips. Consistent and restful sleep is vital for pain regulation and overall health. Manage stress in your life. Recognize that stress is a normal part of life, but learn to identify your personal stressors and how they affect your pain or overall well-being. Practice body awareness techniques like body scanning, and consider keeping a stress diary. Learn and regularly practice breath exercises to help manage stress in the moment. You can start with simple awareness of your breath, then progress to techniques for releasing tension and calming your mind. With consistent practice, you can also explore other stress management techniques like progressive muscle relaxation, meditation, visualization, and even self-hypnosis. Seek counseling or mind-body therapists when needed. Mental health and chronic pain are often intertwined. People with mental health conditions like depression, anxiety, panic disorder, PTSD, insomnia, substance use disorders, and personality disorders are often more susceptible to developing chronic pain. Don't hesitate to seek help from a qualified mental health professional like a psychologist or psychiatrist. These conditions are treatable, and addressing them can significantly impact your risk of developing or worsening chronic pain. Don't think these problems will just go away on their own. Often, the longer you wait, the more entrenched they become. 8 points for managing acute pain. Medications. For acute pain, over-the-counter OTC medications like non-steroidal anti-inflammatory drugs, NSAIDs, or simple analgesics like acetaminophen can be helpful. Talk to your pharmacist about your options, potential interactions with other medications you're taking, common side effects, and how long you should be using them. Apply ice or heat to affected areas. Some people find ice more helpful for acute swelling, inflammation, or sports injuries, while others prefer heat for muscle aches, tension, and relaxation. Be cautious when applying ice. Always use a cloth barrier to protect your skin. If using a heating pad or patch, never sleep with it on, as this can lead to burns. Engage with physical activity or movement. Even with acute pain, gentle movement and activity within your pain limits can often be beneficial. Avoid prolonged rest, as this can sometimes hinder recovery. Light walking, stretching, or specific exercises recommended by a healthcare professional can help maintain blood flow and prevent stiffness. Receive manual therapies. In some cases of acute pain, manual therapies like gentle massage, manipulation, or mobilizations performed by a qualified therapist, like a physical therapist or chiropractor, can help to reduce pain and improve function. Manage your stress levels. Just as with general health, managing stress during an episode of acute pain is important. High stress levels can sometimes amplify pain perception and potentially hinder recovery. Have positive and realistic expectations for treatments. While a complete cure might not always be possible, significant improvements in pain levels and quality of life are often achievable with the right approach. Find a doctor and a supportive healthcare professional that you trust. Having a good relationship with your healthcare team is essential for effective chronic pain management. Look for someone who listens to you, understands your concerns, and works collaboratively with you. Seek medical advice from a pain specialist or a pain clinic. Pain specialists and multidisciplinary pain clinics often have expertise in managing complex chronic pain conditions and can offer a wider range of treatment options. Ask if the clinic has an interprofessional team, which might include physicians, nurses, pharmacists, psychologists, physiotherapists, and occupational therapists. Ask about nerve blocks, injections, and steroids. For certain types of chronic pain, nerve blocks, injections, or steroid treatments might be appropriate to help reduce inflammation and pain. Discuss these options with your doctor. Consider other prescription medications. Medications like certain antidepressants, anti-epileptic drugs, and topical creams can be effective for managing different types of chronic pain, particularly neuropathic pain. Begin seeing a physiotherapist. A physiotherapist specializing in chronic pain can help you develop a tailored exercise program, improve your movement patterns, and teach you self-management strategies. Ideally, find someone who works within a pain clinic setting and has a good understanding of chronic pain. Receive mind-body therapies. Psychological therapies like CBT and ACT can be incredibly helpful in coping with chronic pain, managing emotional distress, and improving overall functioning. If opioids are indicated for pain, if, after a careful assessment of the risks and benefits, opioids are deemed an appropriate part of your pain management plan, have a clear plan with your doctor. Review the potential risks and benefits, and ensure you are taking the medication only as prescribed, with specific and realistic goals determined collaboratively by you and your doctor. If you found this video valuable, please give it a thumbs up below. And don't forget to subscribe to my channel and turn on notifications so you'll be alerted when I post new videos on this important topic. Feel free to leave your comments, suggestions, or questions in the box below. Let me know what you found most helpful or if there are other topics you'd like me to cover. Thank you so much for watching, and I'll see you